answer to that. And there are drugs that are in development that have a longer half-life. So even if they're given for 5 days, you get a longer tail, a little bit like azithromycin.
Yeah. The CEO of Pfizer took 8 days, by the way. Can I bring Peter on for a second? Because the question, if Evusheld doesn't work, what you're doing with immunocompromised people now is, and you take care of a lot of them. So what do you do for them? What do you tell them? Are you still giving Evusheld? As Annie said, it still it's not been pulled yet, although it might be eventually.
I think for immune-compromised folks, it's really a vexing situation. But I think what we're doing is focusing on post-diagnosis treatment in case people break through. And at UCSF, a lot of people around the country weren't even using Paxlovid because they were worried about interactions with calcineurin inhibitors. But at UCSF, working with the pharmacists, they figured out a way to do that safely. So that those would be the ways that we approach it. But there's no real great strategy except making sure that people get adequately immunized and up to date on vaccines and thinking about when they get vaccinated in relationship to when they were most severely immunocompromised.
Great. Are you still recommending?
Thinking about when to get vaccinated? Like, I got the booster in December and it's mid-January. Like they're putting it on their calendar to go in 2 weeks and get another booster. You apparently manage severe immunocompromised patients, and the only words that came out of your mouth are when to get vaccinated. Like, you have no other arrows in your quiver apart from the vaccine for I didn't hear I heard your name. I just don't care. Guy, I treated hundreds of immunocompromised patients. They weren't even patients. I didn't even know them. I just got their history and I was like, holy shit. This is gonna be tough. And every one of them made it. So the fact that you don't have a single freaking thing, not even vitamin D, zinc, like any word, just say a word, medicine-y, that you would tell a patient. Like anything, Guy, it just, please say something.
Evusheld to people, or you stopped?
We stopped.
Yeah. Okay. Annie, thank you so much. I want to make sure we have time for Steve, so really appreciate it. It was really a terrific overview of where we are. Steve, come on and tell us about where we are with long COVID.
How's that a terrific overview? He didn't say anything. What do you do for your immunocompromised patients? Now we figure out how frequently we can inoculate them to suppress their immune system. Just good gravy. This is UCSF. This is the best you've got. My 11 and 12-year-old could sit down with your top doctors and destroy them with knowledge and facts. Oh, hey. This guy's apparently going to talk about long COVID. How can you talk about long COVID if you don't know how to treat COVID? And if you say at any point that you're using vaccines or boosters to help mitigate symptoms of long COVID, I might have to I'm going to have to medicate myself with Seridopa, get some tyrosine and GABA in me.